Hello and welcome to the 9th of several online panel discussions we are having with foster parents called The Arena. Foster Source is partnering with the Colorado Department of Human Services to bring you this series as an opportunity to connect, share real stories and struggles, and proactively provide support. I'm your host, Renee Bernhard. I was a foster parent in Adams County. I'm the founder and executive director of Foster Source. Foster Source is a nonprofit that serves foster and kinship parents statewide with trauma-informed trainings and support groups, relief services like bunk beds, mattresses, and weighted items, and therapeutic services like therapy for the caregiver and equine-assisted parenting practice labs. I'm thrilled to be with you today. National research shows that LGBTQ plus youth are overrepresented in the foster care system. So it's very important that all youth in foster care have supportive adults in their lives. Research also shows that LGBTQ plus youth who have an affirming adult in their life have much more positive outcomes, including better self-esteem and mental health. In today's episode of The Arena, we've invited two expert panelists from the Colorado Department of Human Services to join us for a discussion of strategies and resources for supporting LGBTQ plus youth who are in foster care. Our panelists will be answering questions that foster and kinship parents submitted to us through social media. Today we are joined by Theo Isaz, a training specialist with the Colorado Sexual Health Initiative, also known as COSHI. COSHI provides youth with age-appropriate, medically accurate, and evidence-based sex education. COSHI also provides professionals, trusted adults, and caregivers with training on how to provide affirming care for transgender, non-binary, and gender-expansive youth, as well as how to be an askable adult that youth can come to with questions about sexual health and relationships. We also have joining us Sean Bross, a state residential program manager with the Provider Services Unit within the Division of Child Welfare. Sean oversees a number of contracted programs that expand out-of-home placement access for kiddos with more challenging needs. CDHS's Division of Child Welfare works to strengthen the ability of families to protect and care for their own children, minimize harm to children and youth, and ensure timely permanency planning. The Provider Services Unit provides regulatory oversight, processes licensing applications, enforces rules, and provides technical assistance to ensure the safety and well-being of children in out-of-home placement in 24-hour licensed childcare. Thank you so much for joining us today. Sean, why is today's topic important to you?
So I've been in human and social services for 20 years, nearly all of that working directly with or in programs that impact kiddos in out-of-home care. I'm passionate about continually improving our system to best serve the most vulnerable children and youth and those overrepresented in the system. In my time in the field, I've already seen great improvements in culture, service, and supports for LGBTQ plus kiddos in care, and we still have a long way to go. As a lesbian, the landscape for LGBTQ youth has changed a lot since I was a kid, and I'm excited to be able to help in any way I can to keep that moving forward.
Excellent. Theo, what about you? Why is today's topic important for you?
Thank you, Renee. It's important to me because, for one, I identify as transgender myself, and I know the impact of what an affirming care setting can feel like. I know the impact of what it feels like when you go home and you feel like you're at home, and what a difference that makes for development, for all of life, for success in all of life. And so it really matters to me that we increase the number of affirming settings by just little increments all the time, that we can continue to move the needle for young people so that they're able to truly find success as they're able to be themselves through life.
Thank you both for sharing with us today. All young people need to be accepted for who they are. Creating an inclusive and accepting family environment is so important for all young people because a young person's gender identity, gender expression, and sexual orientation may change over time. Theo, I'd like to start with you. Could you explain the terms that we're using today, like LGBTQ plus and gender identity? What are some important terms to use and understand when talking to youth, and what are some terms that can be offensive?
Yeah, that's a great question. Thank you for asking. So frequently when we're talking about LGBTQ youth, we just sort of lump all of that together. We just say like LGBTQ, or we talk about sexual orientation and gender identity, and we make that one, we conflate all of those things together into one identity, when those are really distinct pieces that go into who a person is and how they identify, how they feel about themselves and how they feel about other people. And so I'd like to separate out those pieces. So oftentimes a lot of the L, G, and B, so lesbian, gay, bisexual, all go into the bucket of sexual orientation. And those are, how does a person feel romantically, physically, emotionally? Who are the kinds of people someone connects with? Who does one feel attracted to? Those are all sexual orientation. Where gender identity and gender expression are about how does a person feel about themselves and portray themselves to the world. And we can't really guess anything about a person's sexual orientation based on their gender identity or their expression, how they show up in the world, and vice versa. We can't guess the other way around either. And so someone's gender identity is how they think about themselves. When you are alone in your own space and feeling who you are and the core of of your identity, how do you think about yourself? What is your gender? Is that more masculine, more feminine? Is that something in between? Is that a little bit of both? Is that neither? That's a person's gender identity. So when we talk about someone who's transgender, that's someone whose gender identity, how they think about themselves, is not the same as their sex assigned at birth. When they were born and the doctor said, it's a boy or it's a girl, usually based on their genitals, that is separate from how a person thinks about themselves. If you think about the sorts of buckets that we create for what a person's supposed to like and what a person's supposed to do, none of us are perfectly aligned with the buckets that are expected of us. And so a person's gender identity is about their relationship to those buckets, their relationship to those expectations, and how they actually feel at the core of themselves. So you might hear the terms transgender for gender identity. You also might hear things like non-binary, which is when a person doesn't experience themselves to be either gender, or they experience themselves to be something in between. You might hear terms like agender, someone who doesn't experiences themselves to be without gender, or genderqueer, gender nonconforming. There are lots of different terms that people might use for some of those different gender identities. The key is not that you need to know all of the words and all of the terms. The key is that you approach people respectfully, and you approach people being eager to hear about their experience of themselves and reflect what they're saying about themselves back to them, allowing them the space to be themselves.
That's super helpful. Are there any of those terms that would be considered offensive?
Some of the terms may be complex. So for example, the word queer has a varied history. For some folks, queer was a word that was used as an insult, and they would never want to hear someone use the word queer. Meanwhile, a lot of young people today and newer generations of folks have been reclaiming the word queer and have been saying, that describes who I am. It doesn't fit into your boxes. I'm expanding your boxes. I'm changing your boxes. So it all depends on how someone says a word and reflecting back to them what's respectful to them. Like, you would never walk up to someone and be like, you look queer, right? But if someone says, I identify as queer, and then you use that word respectfully, that's a very different situation. One word that we do veer away from is homosexual, because that's a term that has been used as a negative diagnosis on people. So people will identify as with whatever word they use to describe themselves, generally like gay or lesbian, bisexual, pansexual, but to use the word homosexual for someone tends to have a lot of stigma to it.
Okay. Thank you, Theo. Sean, all children in foster care have barriers that they face, but LGBTQ youth face additional barriers. Would you talk a little bit about those additional barriers?
Yeah, absolutely. So LGBTQ plus youth may experience less acceptance and support within the foster care system. Even if child welfare staff, foster agencies, and foster families have committed to equal treatment and rights of LGBTQ plus children and youth, the degree of training and the culture of the families or agencies they encounter may vary. Foster care agencies and CDHS offer training to help professionals and foster parents understand the needs of LGBTQ plus children and youth, but those adults may have intrinsic biases or beliefs that put the acceptance and support of these children and youth at risk. Some communities may have less access to supportive resources, to affirming mental and physical health care providers, and to supportive school environments. So even external to a supportive and affirming home, that kiddo may experience barriers depending on where they are placed. Sadly, many kiddos in care experience multiple transitions in care settings. Each of these transitions brings another opportunity for that kiddo in care to wonder if they will be accepted, if they will experience unfair treatment, or be exposed to bullying. Kiddos who are in foster care, like all LGBTQ people, will experience coming out not just once, but every time they meet someone new. When those new people include a family that will be responsible for caring for you, that can be extra anxiety-provoking. We also know that people could explore or begin to understand their gender or sexuality at any point in their lives, and this is particularly true in adolescence. So one of these kiddos who may not have identified as LGBTQ+ at the time of placement could do so during placement. They may have been matched with a family for whom working with LGBTQ+ children is not an area of strength, and then can worry that the support will not be available. For transgender or gender-diverse children, professionals involved may not focus on or understand the child's preference for where they would feel safest and most supported in homes, schools, or other settings. Additionally, as with all medical decision-making for kiddos in foster care, these children may experience hardship in accessing gender-affirming health care and services.
Thank you, Sean. That's very helpful. Theo, when we train foster parents at Foster Source regarding caring for LGBTQ youth, we often hear the fear that they won't show up appropriately for these youth or in a way that is right for them. Can you talk to us about how we can show LGBTQ plus youth that we don't have a rapport with or that we're just newly meeting, that we are a safe person for them to come to, even if we're still learning?
Yeah. The key to gender and LGBTQ inclusive care is not assuming who the person in front of you is. And the challenge is that in life we are wired and we're well trained to make assumptions about who the person is, what gender they are, who they might be attracted to, because that's culturally the assumptions that we've learned to make. And the key is to remove those assumptions and to ask open-ended and curious questions, not curious in like a I'm digging into who you are sort of way, but curious in a I want to care about you sort of way that allow the young person to define themselves to you and then believe them with what they have told you along the way. So allowing people the space to define themselves is key, and then reflecting what they have told you and how they've defined themselves back at them in the process. So for example, if you were talking to a young person about the people that they might date, instead of assuming and asking like, have you had any boyfriends? Have you had any girlfriends? Ask, have you ever dated anyone? Have you ever been in a relationship with anyone? Or what are the sorts of things you look for in a relationship with someone? And allow those open-ended spaces for young people to tell you who they might be interested in or who they might have attraction to. or giving young people the space to share their pronouns. For example, introducing yourself to someone and saying, "Hi, I'm Theo. I use they, them pronouns, and I'd love to know how to respectfully refer to you. Could you share your pronouns with me if you're comfortable?" Allowing that space, and also allowing youth to say, I don't want to tell you right now, or allowing that youth might change in their answer over time as they become more comfortable. I've had classes where I've worked with young people where the first class we start with introducing ourselves, sharing our name and pronouns. And youth have started from the first class having one name and using their pronouns that align with their sex assigned at birth. And over time throughout the class, as they've become comfortable with me, it'll be the third or fourth class in that they'll say, "Actually, I'm wondering if you could call me by this other name. And I'm wondering if you could try using these pronouns." And then by the end of our time together, the young people will say, "This is my name and these are the pronouns that I use." Because they've been given the space to say, it's safe for me to ask. And then when they asked for it, I respected what they asked for. And they've got to feel the joy of that affirmation. And by the end, they get to be aligned with who they are. It's also important to allow the space for youth to grow and change over time. I think specifically with LGBTQ youth, we expect for them to come out once and have their final answer for the rest of their life. Like, tell me what you are, and then we're going to stick to that. And sometimes adults can even get frustrated if a young person tries different pronouns or asks for, "I want to try they, them. Actually, I want to try he, him. No, I want to try they, them." And sometimes adults will get frustrated in that process. And I want us to reflect on how we've grown and changed as humans, how you might have grown and changed across your lifetime, how the person you were when you were 12 is still the same core person. Your person hasn't changed, but your understanding of who you are has certainly changed since you were 12. And we want to have the flexibility to allow young people in their understanding of themselves to grow and change over time as they find what aligns for them. And so I encourage you to remind yourself, if you find yourself in the situation that it feels frustrating, that a young person might be trying different names or might have different language for themselves from week to week or from meeting to meeting with them, that you allow for that process of exploring and trying things on and saying, "This fits, no, this doesn't fit. This fits, oh, this does fit. This is closer." And affirm that process along the way. Just like our sense of style changes across our lifetime, right? As we start to understand who we are.
I think for caregivers to know that and hear that is really helpful. To hear that it's normal and it's healthy and it's okay. So thank you for sharing that, Theo. Now, let's discuss some resources that might be helpful for foster and kinship caregivers who are caring for LGBTQ youth. We know youth in foster care, and particularly LGBTQ youth, may feel lonely and isolated at times. Are there any mentoring groups or community groups that caregivers should know about for either one of you?
The Transgender Youth Education Services, or TIES, offers support groups for parents and families and young people across the state. You can also find a number of local resources for different areas within the state. So, for example, there is Splash Youth of Northern Colorado, which serves Fort Collins, Greeley, Windsor, Loveland, and Estes Park. There's Oasis Boulder, which is part of Boulder County Public Health, that serves Boulder and Longmont. You can also look for Out Boulder County, which also serves all of Boulder County. PFLAG has chapters around the state for parents, families, and loved ones of LGBTQ plus people. Rainbow Alley is a youth drop-in center that's in Denver, and Inside Out Youth Services is another youth drop-in center in Colorado Springs. The Rainbow Youth Center is located in Southwest Colorado. You can also access Youth Zone or The Space in Glenwood Springs, and Youth Scene provides mental health care for LGBTQ plus youth, especially BIPOC youth statewide.
Sean, what trainings are available to foster and kinship parents to help them become better allies for youth who identify as LGBTQ? I know at Foster Source we've hosted Theo and Koshai before to teach trainings, and we'd love for our caregivers to get as much training as possible. What else could they access?
Yeah, absolutely. There are also trainings available in the Child Welfare Training Academy for CDHS. Additionally, there's a number of great trainings from the Human Rights Campaign through their All Children, All Families platform. Also, we would encourage foster families to talk to their sponsoring agency, whether that's a county or a child placement agency, to ask them if they have support groups with other families who've worked with these youth before, or if they offer any specific training or are connected to a larger foster care organization like Foster Source.
Having a therapist that the youth can trust is really important. Are there any meaningful resources for finding LGBTQ plus friendly therapists?
For children and youth who are placed in foster care, most of those kiddos are on Medicaid. And HCPF, which is Healthcare Policy and Financing, Colorado's Medicaid oversight entity, does maintain a list of LGBTQ affirming and supportive healthcare providers as well as clinicians. So that can be found by searching through the HCPF, HCPF website.
Theo, what are some strategies and resources for supporting young people who identify as transgender?
Yeah, thank you. We oftentimes jump to the assumption that when young people are transgender, the way to support them or what gender affirming care looks like medical intervention. And for the most part, when we're talking about people of all ages, some of the biggest forms of gender affirming care are simply letting folks, again, use the name that feels good to them, use pronouns that feel good to them, play with the toys that feel good to them, wear the clothing that feels good to them. Letting them play with other kids that feel affirming to them, instead of trying to force them into one sort of play or one sort of clothes or one sort of setting. And so frequently, gender affirming care is simply about letting somebody find their joy in life and find the things that feel aligned to them. It isn't until we talk about young people in adolescence or in the starting stages of puberty that we even start to look at any sort of medical intervention. And all of the medical interventions with younger children are completely reversible. And so sometimes I think in culture, there is this assumption that when a child comes out as transgender, they're wanting surgery that changes their bodies at the age of 6, and that's just simply not the case. Physicians won't do surgeries on transgender folks until they are adults. And so for the most part, gender affirming care for children is letting them read books that have characters that look like them and letting them explore the world in ways that feel affirming to them.
Super helpful. Thank you. Finally, we know having just one affirming adult in a youth's life is very meaningful for creating positive outcomes for that youth, but it's beneficial if loved ones in a youth's life can also affirm and support them as well. The goal of foster care is to heal family relationships and support reunification. Let's discuss how foster parents can help to nurture family support for LGBTQ plus youth. In many cases, it's easy to make bio family members out to be the quote-unquote bad guy, especially in situations when bio family is against the child's identity or orientation. Theo or Sean, do you have any advice for foster parents who are navigating strained family relationships in a way that supports the youth but doesn't alienate their family members?
I think the number one focus is to be as supportive of the kiddo in care as possible. We know that visibility for LGBTQ plus people is incredibly important, and for a biological or legal family to see their child thriving in an environment where they're affirmed and supported, that can go a long way. If it's appropriate within the family's service plan, the foster parent could share their resources, experiences, and what led or helped them to become an affirming and supportive parent. Hearing this parent to parent can be particularly helpful. When a child or youth talks to the foster parent about their experiences, it's going to be important to validate their experience, remind them that they're good and valuable and loved, and that they don't deserve any of the harm that they have experienced in the past. At the same time, the foster parent should avoid statements making judgments about the biological family. It may be hard to avoid this, especially for people who care about kiddos and want to protect them from being hurt. But we don't want to create any other fractures within the family system at the same time.
Thank you so much, Sean. Theo, any closing advice for caregivers of LGBTQ youth?
Yes, I would like to encourage caregivers to give yourself grace and to give yourself some softness, because I think sometimes one of the hang-ups in our culture around accepting LGBTQ folks is all the ways in which we were not accepted for all of our quirks along the way throughout our life. And so this is your opportunity to, in the process of accepting this young person, to also be able to love and accept all the pieces of yourself that you maybe haven't gotten to explore along the way through your life. So give yourself grace and allow yourself a little bit of space to experience your own joy of affirming who you are.
What a great way to end today. Thank you, Theo. Thank you, Sean, for being on the panel. Foster parents and caregivers can find additional research, many of the local and statewide groups we discussed today, organizations, and more to support young people who identify as LGBTQ+ under the Foster Pride section of co4kids.org. If you're thinking about becoming a foster parent, the first step is to attend an informational meeting at your local county or child placement agency. You can find all of the information about upcoming meetings at co4kids.org. The Colorado Department of Human Services also hosts a foster care information booth at Denver Pride each year. If you'd like to connect with professionals in person, stop by the booth. Not quite sure if you're ready to become a foster parent? There are still lots of ways to get involved. You can be a CASA, a court-appointed special advocate. You could volunteer as a neighbor with our friends at Families Together, or you could support other foster care nonprofits in your area like Foster Source, the Colorado State Foster Parent Association, and Fostering Great Ideas. The information regarding those agencies is also listed at co4kids.org.